10 millimeters of expansion is going to give you a 20%, 25% increase of nasal volume. You'll breathe that much better in your nose.
It's crazy.
So people don't consider that when we expand, we're not just treating this and making room for the teeth and making room for the tongue to sit up in there too.
Yeah.
We're actually opening up the nasal cavity that's getting wider. And so we're treating the whole nasomaxillary complex.
You're listening to Be Well by Kelly Levesque. Dr. Tracy Tran graduated from USC's Ostrow School of Dentistry and has advanced training in oral surgery and pediatric dentistry, along with a master's in biomedical science. She combines clinical precision with a compassionate, family-centered approach to care in Newport Beach, California. Since being in private practice, Dr. Tran has focused her continued education on pediatric tethered oral tissue, TOTs, and its relationship with oral dysfunction in order to diagnose orofacial myofunctional disorders, or OMDs. This includes difficulties with infant nursing, toddler feeding and swallowing, speech articulation, and pediatric sleep disordered breathing. She has successfully treated these patients through a collaborative team approach and continues to expand her knowledge and experience in this niche specialty. Dr. Tracy Tran, I finally got you across the table.
I'm so glad.
I know.
You were so sweet. I'm excited for this. I've been looking forward to this.
Oh, honestly, I feel like if anyone can explain airway health and tongue ties and expansion just to the moms who need to hear it most and the dads, you're that person. I think sometimes people speak about this stuff really high level, but you do a really good job of explaining the why. And you're seeing both of my boys, and you just clipped Julian's tongue tie. So we're just at Dr. Tran's office a lot. My audience knows that I'm kind of obsessed with airway health right now.
Yeah, which is great.
Being that Sebastian has been, a bedwetter and we can't get him out of a pull-up. And we have, he had the tonsils and the adenoids. And luckily, you were out on maternity leave when we did our first expansion with Dr. Cruz, and I had him on the show, and we talked a little bit about the importance of that. Yeah. We were only able to do a top expansion, but we've tracked it with CBCTs with you the whole time.
Yeah.
And I'm just excited for what's to come and the future of sort of dental health versus pulling teeth and throwing braces on, but really getting ahead of it. And that's what you're so good at. Yeah. So how the heck did you get into this?
Oh my gosh. It's a long journey. And I started back in 2016 or something like that. I met an OT actually who was really into all of this. And I didn't have any clue about it, but what happened was we were at a barbecue, and I had been seeing so many kids in my practice. At the time, I was actually practicing in Texas. And all these kids were coming in on ADHD medication, and parents would always ask, my kid's grinding their teeth so much. Why are they grinding so much? And I would look at these teeth, and they would be down to nubs because these kids would grind all through the night constantly. Mm-hmm. And the answer I would give, which is, kind of a cop-out answer, that you give when you don't really know the answer is, they'll grow out of it. Because that's what we're trained on. We're not really trained on looking at these things in our formal education. So when I met this OT, she was saying, oh my gosh, do you treat tongue tie? You're a pediatric dentist. There's kids who have ADHD and they grind their teeth and they have all these other issues. And I'm like, whoa, this is really far-fetched, tongue-tie, ADHD, not making the connection at all. So, but I was curious, and she sent me to the Academy of Orofacial Myofunctional Therapy, and I took this course on frenulum inspection workshop, and there was an ENT, Dr. Suresh Zaghi, who was speaking there.
I know Zaghi.
Everybody knows him. He's great.
Yeah.
And he totally presented research and facts and opened up my mind to this. And I'm like, wow, this is actually something that matters. And they had some parents that were giving their own testimonies as to what releasing a tongue tie did for their kids. And so here I am seeing in dentistry, the other side of it is doctors saying, no, this doesn't do anything, don't treat this. And on this other end of the spectrum are parents who are like, it's so hard to find people to help with this. It helped my child so much, but at the same time, it took so long to get here.
Yeah.
Pediatricians said don't do anything. Lactation consultants said to do nothing. It wasn't until they got the right lactation consultant who would say, yeah, there's a tongue tie, you should fix it. So once I jumped down this rabbit hole of tongue ties, it led me towards Airway, because naturally that's where it will lead anybody.
Yeah.
Because tongue tie is a little part of this whole puzzle. Like the big picture is there's some developmental things that happen when you have a tongue tie, and the developmental things tend to be airway related. So I started diving deep around how that development happens and how can we help kids early on with that. So, just to elaborate a little bit more on that is, as I was learning about sleep issues, sleep apnea, and the symptoms of grinding your teeth when you're not breathing well, and reading studies. There's a long-term study that was done. It's called the ABCD study. Have you heard of it?
Mm-mm.
It's the Adolescent Brain Cognitive Development Study.
Okay.
It's the largest long-term study done on children to adolescents. And they did MRIs on these kids, and they found that the children who snored regularly 3 nights a week, that's all that you have to do to be considered a regular snorer, just 3 nights a week, they all developed less gray matter in their prefrontal cortex, that's what they would say.
Associated to ADHD.
Right. That's where your executive functioning skills are managed, and that's how they diagnose ADHD, is they test all your executive functioning skills. So,
wow.
Yeah. So then I made that connection. Okay, here's the sleep breathing issue. Here's the ADHD problem. And then grinding your teeth happens when you cannot breathe. It's a trigeminal response. It's what we do when we're under stress. Is what do you do when you're in fight or flight?
Yeah,
you're
you
gonna bear down,
clench.
clench your teeth, grind. And so that's one of those symptoms. And anyway, so I went down this whole path of understanding, how do we treat this in adults? And one of those treatments to treat an adult is to do something called maxillary mandibular advancement surgery. So they'll break the upper and lower jaw, and they'll bring that forward, and that opens up the airway, and it helps these adults breathe. And then when these adults can breathe, their sleep apnea is technically cured.
Yeah.
Now, when we relate that to growth and development for a child, you don't have to break the jaw in a child, because their jaw is still in pieces. The facial bones are still separated. So the question has always been, if this is what we do in adults, could we actually treat this in the kids early on to prevent them from developing this problem as an adult? And it sounds so out there, but at the same time, it's very common sense.
Yeah.
We know how development happens. And I think I explained all of this to you
Yeah.
when you came to see me, but it can be complex, I think, for parents, right? Would you say you run into that?
Yeah, well, I feel like being in sort of this wellness world, what's happened is people used to talk about pulling your wisdom teeth out and getting braces and having straight teeth. And it's moved to this place of no, expansion early, airway health, proper development. And when I think about Paleolithic faces and the wide cheekbones and the forward jaw, that all makes sense to me. And understanding that if you have that space and your tongue is sitting in the right place, that you're able to breathe the right way through your nose and have an open airway, getting a lot of oxygen into my body sounds delicious.
Right.
Yes, let's do that. I'm on board. What's interesting is I don't know, how long have parents dealt with all these symptoms that I'm dealing with, whether it's restless nights of sleep, and you came in saying, you have a toddler and a 6-month-old and had a hard night's sleep. I got here this morning before podcast and I was like, Sebastian has swimmer's ear from a birthday party. He was up at midnight. Then Tashin had to pee at 2:30 and then technically, quote unquote, had a nightmare at 4:30. So I basically had a newborn sleep. And I think about okay, their disrupted sleep, kids snoring, tearing through their sheets, bedwetting, grinding, huge tonsils and adenoids. I'm growing up in the 80s and 90s, did we all just have these symptoms and our parents were they're fine?
Yeah.
There
was actually a time when these symptoms, there were facial features that were recognized by ENTs. And I think when we were growing up, it was actually a lot more common to get tonsils and adenoids taken out.
Yeah.
And they actually, if you look up medical literature, it will talk about something called the adenoid face.
Yeah.
Have you heard of that?
Mm-mm.
So the adenoid face is basically when you have enlarged adenoids,
Yeah.
kids will have certain facial features that show that they have this problem. Those features are having a long, narrow face,
Mm-hmm.
and then lower jaw is protruded,
Mm-hmm.
mouth is hanging open,
Mm-hmm.
eyes downward slanted,
Mm-hmm.
dark circles under the eyes. They basically look, tired.
Wow.
And when we describe the adenoid face, the question is, how did we even get there? How did they develop into this? And it has a lot to do, I'll show you with the skull.
Yeah, do it.
It's better when you can actually see it. So the maxilla here, this is the growth center of the face. So the way I explain to most parents is, everybody knows how cranial growth happens is you've got the brain, that's soft tissue that's growing and expanding. And as it grows, you've got these spaces between called sutures. And these sutures will get wider and wider as the brain expands.
Mm-hmm.
Well, once they widen out, bone starts to fill in between.
Yeah.
So that's how the head will develop. The face is no different.
Mm-hmm.
Now, the maxilla is the growth center of the face. And the tongue is the soft tissue that influences this development.
Got it.
So that's where the tongue plays a role in all of this, because if the tongue is not rested up against the palate, like in mouth breathing,
Mm-hmm.
right?
Yeah.
And when you have enlarged adenoids, you can't breathe through your nose.
Yeah.
So you're going to breathe through your mouth.
Yeah.
And when that happens, the upper jaw won't expand because there's a suture here that's supposed to widen. And if it doesn't widen, then you end up with a very narrow palate. That's high too, because this is the growth center. This will get bigger. The nasal cavity is like a triangle that will widen out.
Yeah.
The nasal valve will open up. And this maxillary bone makes up part of the orbits. So if you see how it makes up part of the inside of these eyes, that's how the eyes end up rotating out as the face expands.
Wow.
So when that doesn't happen, you see downward slanting of the eyes. But when we expand, like you might look at pictures of your child before expansion and after, and you might see that the eyes opened up if it's done properly.
Yes.
So that,
My new amino acid supplements come in flavorless and lemon water, and they're flying off the shelves, and here's why. I have meticulously sourced these vegan fermented essential amino acids from Japan. I am so proud of this being made the Be Well way, with maximum quality and minimum ingredients. My flavorless is simply those vegan fermented essential amino acids from Japan. Our lemon water contains minimal ingredients of only organic lemon powder, organic citric acid, and organic monk fruit. No natural flavors, no artificial flavors, no artificial sweeteners, no emulsifiers, no additives. This is simply that nutrition targeted for your goals. If you want to give my Be Well protein or aminos a try, or restock it if you're already loving it, take advantage of my gift for podcast listeners. Code PODCAST10 is going to get you $10 off just for being a listener. Write it down and shop with me after you listen. Winning your mornings starts with a strong night routine. For me, sleep is everything. If I don't get it, my whole day feels off. And that's why I'm so excited about AG1's brand new nighttime drink, AGZ. AGZ is designed to support restful, restorative sleep with clinical studied ingredients, including adaptogens, herbs, and minerals. It's melatonin-free and works with your body's natural sleep cycle to help you fall asleep, stay asleep, and wake up feeling refreshed. It's the perfect nightcap, especially during the back-to-school season. I love to drink it about 30 minutes before bed, warm with water, and my favorite book. The difference in my sleep has been incredible. I fall asleep faster, sleep more deeply, and wake up energized, not groggy. AGZ helps me optimize my sleep so I can show up fully for my mornings and my day. If you want to take your sleep seriously, I have a special offer for you. Head to ag1.com/bewell and get your free welcome kit with the flavor of your choice, including a 30-day supply of AGZ and a free frother, because sleep tonight really does define tomorrow. Well, it's so crazy to me because this is why I love for you to explain things to me, because I think you do such a good job. Like, I think about the brain growing and the sutures of the skull, like opening up and spreading out and then rebuilding bone between. And I had always thought, okay, like if that suture up the middle of like the roof of my mouth is technically, and we're going to talk about this because I want to know like when does everything like finish growing?
Yeah.
But if my tongue is that like pressure point, not my brain, right? Pushing up and pushing out, not only is it pushing the roof of my mouth like flatter and more wider, but my nose is opening, my eyes are opening and going wider. And that's when you get the like Giselle style, like high cheekbones that go wide.
Exactly. So these are aesthetic things, but it's a representation of health. Like this is a healthy face that you want to see, where we know an unhealthy face is somebody who, I mean, I hate to say, people always reference Napoleon Dynamite.
Yeah.
It's like mouth is open and he seems like he's sick.
Yeah.
And back in the day, they used to equate that to intelligence too, which is like really sad.
Yeah.
But the intelligence part probably comes from the fact that they're not getting good sleep.
Yeah.
So it's hard to learn. So imagine your child's going through that. They're not sleeping well. How do they pick up information the next day? How do they hang on to that information?
Yeah. Because
sleep is where the brain develops. It's where your sleep spindles are activated when you're in your REM cycle of sleep. But if they don't actually get to the REM cycle because something is disrupting that, then that's where quality of brain development is impacted. And by 6 years old, we're already about 90% developed with our brain.
Yeah.
And that's why I've been so passionate about treating kids really early on.
Yeah.
Because it's not just about developing the face. It's about
all the things they're learning.
Everything.
In toddlerhood.
It's a whole chain effect. So, but the tongue lifting up to the palate and helping it to expand, that process happens in utero. So when you've got a baby that's born with a tongue tie, they're likely going to have a narrow palate.
Yeah.
And so this idea that like people might say like, oh, a tongue tie cannot cause a narrow palate. But we know in utero, the tongue is supposed to lift off at about 8 weeks.
Yeah.
And at 10 weeks, it's supposed to start, that's when movement starts to happen and it puts pressure on the palate that is in two pieces coming together. Then the tongue lifts up and helps it to separate.
Crazy.
And so when they're born with a tongue tie, they've already had about, 28 weeks of development?
Yeah. That didn't have that
development.
That contact and that expansion.
Yeah.
And that, wow.
Yeah, because the tongue was low.
Tied down.
Yep. So.
Wow. Okay. So let's, I want you to answer one question, then we can go into tongue ties because you just released Julian's.
Yeah.
So when you think about like someone getting, let's say, wisdom teeth out and braces put on like I did in, the 2000s, early 2000s, when you think about something like that, I guess it was the 90s. I'm like,
when was it again?
Young. Yeah. When was high school? The 90s.
For me too.
To the 2000s.
Yeah.
But like when you think about that, like versus expanding a palate when all these sutures are mobile and they don't have, like that you don't have to break jaws to do it.
Right.
Like what is the ideal timeline of getting expansion done, making space, making sure you have like full maxilla development prior to
it's a great question because that's the basis of why I do early treatment, right? Is because just like the cranium's 90% developed by 6 years old and the brain is, so is the face.
Yeah.
Like facial development, all that bone movement is so rapid early on in life. So we already know what happens in utero, then they're born. And if you think about it like in like, what do you call it? The proportions of the head and the body. The head's way bigger in an infant than the rest of their body.
Yeah, it's like a puppy.
Yeah.
Paws and a head.
Exactly. So when they're born, they've already had so much growth. Then by like 3 years old, there's so much growth happening, not just with the bone growth itself, but functionality. They're learning how to suck and swallow. And that's right when they're in utero, they're already sucking and swallowing. Then they're born, they have to learn how to breastfeed and bottle feed. And then when they get to 5 months old, 6 months old, you're introducing solids. So then the activities of chewing and rotary movement of the jaw and being able to create a bolus that starts to develop. Speaking starts to develop. So these are things that people will have problems with when they have a tongue tie, right?
Yeah.
So speech might be impacted. And then if the tongue is down low, that can fall back into the airway, and then breathing is impacted. And by 3 years old, you're already established with how you use your mouth. And the face is already developed to about 70 to 80%. So if we see these functional problems early on and we don't address it, there's the chance that it will negatively impact that jaw development, because if you can't move your tongue, you're going to compensate. And if you compensate, one of those compensations, keeping it low, will develop into that improper facial development. And so to answer your question, best time to address it, there's so many things to consider behaviorally as well. Not every child at 3 years old could manage an expander. I should have brought some expanders today.
Yeah.
Think about that.
That's okay.
But I find the best time to start is at 4 years old.
Yeah.
And the reason being is because the teeth that are up in the jaw, which is going to be, these are adult teeth, but the baby teeth are technically up in here in the bone. And if you start at 4, you will actually make room for those teeth to come in. Yeah. And those 2 front teeth on the top and bottom are the 2 first ones to come through.
Yeah.
Now, if you expand and you're opening this up in the center here, those teeth will have room to drop in.
Yeah.
If you don't do that, then the teeth will drop in, but they'll take up space of the teeth behind it.
Yeah.
And then when those teeth come in, those will also take up the space of the teeth behind them.
Yeah.
And then the next ones that will come in will not be the canines, but the premolars.
Okay.
And so the premolars will come in, but now the canines are trapped. And that happens a lot. It's one of the most common, it's the most common tooth to be what we call ectopically erupted. It will be trapped up in the bone and it won't find a way through, or it will come in too far towards the front or on the inside of the palate.
Yeah.
And it's because
there's no space.
There's no space. And so a lot of people are like, well, let's wait till they're like 8, 9 years old. And by then, all the teeth in the front are in, top and bottom. 6-year molars are in. So now we're trying to take space in the back, but those teeth are already in. So now you're squeezing everything forward, and that's why the canines get trapped. And I'm sure there's plenty of people out there who will say like, oh yeah, I had a tooth trapped, and the surgeon had to open up the bone up top, put a bracket on it so that the orthodontist could pull it down into place. We know if we do early treatment and make that room as they progressively develop, those teeth can come in just fine. They'll find their way in. And then we will prevent the need to take out permanent teeth in order to make space for those teeth. And then if we have to take out permanent teeth, though, what are we doing? We're making the mouth smaller.
That's what I was just going to say.
Yeah.
Like, I feel like if you can think about, I think about getting all of these teeth extracted after, when I was growing up, because I have a narrow palate, I have a small mouth.
Yeah.
I'm like, how do I widen it? I have no teeth to drop in now. What a bummer.
Yeah.
But just to have your palate grow wide enough to get all your teeth to drop in, and then to kind of like maintain that foundation of airway health the rest of your life, like goals, absolute goals, right? So okay, so when you think about development, like thinking about like that, canine getting stuck or whatever. So if a kid starts at 4, so like we did start Tashin a little earlier than that. He was 3.5. You were on mat leave, and now we're doing our second set of expansion with you. We're doing a top expander and a bottom expander. Yeah. We didn't do the bottom. That wasn't available to us with Dr. Cruz. And if people have listened to that episode, great. Yeah. You get the baseline of like why we wanted to think about airway health and kind of get them out of distress. But what is the difference between like what's available in expansion? There are so many options. There's obviously just the upper, like we did with Dr. Cruz. We're doing an upper and a lower with you for like our second phase with the boys. There's something called an ALF. There's a tooth pillow. There's all these different things.
So many things on the market.
Can you talk to me about like, if the goal is to open up the maxilla and get like the widest, flattest top palate where the tongue can suction and the teeth on the bottom to support that, like what should we be doing for that?
So the goal is always to grow the bone while the bone is growing. And I always, like, one of my favorite things to say is you cannot grow something hard with something soft.
Yeah.
You have to have enough pressure, and it's physics. You have to have enough consistent pressure in order to open up that suture.
Right.
And the expander attaches to these teeth,
Yeah, the back
which,
teeth.
are held into the bone by ligaments. So if we're attaching the expander to this and we're expanding, one of the things that tends to happen is the teeth will tip out. So you need to, when you're doing the expander, you're turning, right? You're turning to get the jack screw to widen out. And two things are happening. You're getting something called skeletal expansion. So the actual bone, the skeleton is opening up. And then you get dentoalveolar, the teeth up top that tip out.
Split.
Yeah. And so imagine these teeth up top are getting pushed out. Well, now it looks like it's wider. And that's what I measure on a CBCT is I measure between these molars. But we could measure it and it would say that we got expansion. But actually what I measure is the bone down below. I'm looking at the bone itself and I'm looking for bone growth. So if one of the things I'll do on CT scan is I'll measure the permanent teeth up top because we can see that on the CT scan.
That was fascinating for Sebastian. Holy cow.
Yeah.
Go ahead. Explain it.
So we'll measure that, but I'll also measure how much space they have from canine to canine. And then I'll measure each of the individual teeth, permanent teeth that are supposed to fit. Because everything in the front is developing early on. So that's what I'm focused on. And as long as we develop the front of the face properly, the rest of the teeth in the back will have its space. We don't have to stress about that.
Yeah.
But if I measure each of the teeth and they're not going to fit in the space that's present, then we know that discrepancy is what we're trying to close the gap on.
Right.
So say, I forget how many millimeters.
I think it was crazy. I think you said like he had, at some point he had like 42 millimeters of space and he had 53 or 54 millimeters worth of big teeth that needed space. And I was like, okay,
10
so we
millimeters.
have like a 10 millimeter discrepancy here. And obviously he's 6 and his face is going to grow. And I think when you first scanned him, it was 5.5. Like, his face is going to grow part of that, but we can't guarantee if he doesn't have proper tongue alignment and proper myo, and we're trying to do the myotherapy, but like he has a restricted tongue. We know that. Sebastian also needs a release, and his doesn't look like mine where it's like a
obvious
string in the middle kind of a thing. His is like more just like looks like the back of his tongue is stuck down.
Yeah.
And I think you called it a mid-tongue restriction.
Yeah.
But I was like, how are we going to get to where we need to go? And you explained I'll let you explain it, but a certain amount of millimeters for expansion and a certain amount of millimeters for facial growth, but like also tracking his growth before he gets to a certain age to make sure they had space. If you're trying to stay hydrated this summer without the sugar, food dyes, or mystery ingredients found in typical sports drinks, let me introduce you to Element. It's a zero sugar electrolyte drink mix made for people who want to feel their best. Now, whether you're chasing your kids around the park, powering through a workout, or just trying to beat the mid-afternoon slump, electrolyte balance is key. Low levels can show up as headaches, fatigue, muscle cramps, and even brain fog. Element delivers a science-backed dose of sodium, potassium, and magnesium with none of the junk. And right now, I am absolutely in love with their limited time lemonade salt flavor. It's tart, salty, and basically summer in a glass. I love that I can enjoy this nostalgic taste of lemonade and feel good about sharing it with my boys on a hot summer day. Element lemonade stands incoming. We made one, we had one, it was the best. Check it out on my Instagram feed. And here's the best part. You can try Element totally risk-free. If you don't love it, they'll refund you. No questions asked. Plus, when you order through my custom link, you're going to get a free 8-count sample pack of Element's most popular flavors, including 2 stick packs of citrus salt, raspberry salt, watermelon salt, and orange salt with any purchase. So just head to drinkelement.com/Kelly. That's drinkelement.com/KELLY. It's the perfect way to find your favorite and share with a friend. Are you looking for something simple and delicious to add to your wellness routine? I used to add regular honey to everything, tea and salad dressings, but once I tried Manucora, I never looked back. This isn't just any honey. Manucora is rich, creamy, and so complex. It feels indulgent, but it's packed with powerful nutrients that support our gut health and immune system. Their honey is ethically produced by master beekeepers in a remote forest of New Zealand, where bees collect nectar from the Manuka tea tree. The nectar is loaded with bioactives, including MgO, a special antibacterial compound that sets honey apart. One of my favorite ways to enjoy it is straight off the spoon. It's indulgent and sweet. Right after a meal, it kills all of my sugar cravings, and it's the perfect dessert that provides so much more than sugar. So if you're interested in trying it, head to manucora.com/Kelly to save up to 31% plus $25 worth of free gifts with the starter kit, which comes with the MgO 850 plus Manuka honey jar, 5 honey travel sticks, a wooden spoon, and a guidebook. That's manucora.com/Kelly to save 31% plus $25 worth of free gifts.
Yeah.
Yeah.
So it takes time to get there.
Yeah.
Like one expander, and the type of expander I use is called a Haas expander, but the specific design is from this orthodontist on the East Coast, Dr. Mariana Evans. But there's an acrylic piece that goes up into the palate, and it sits in the palate.
Yeah.
And the jack screw's embedded in that. And then the bands are on the teeth. And when you are turning that jack screw and it gets wider, by the time we're done, one jack screw can maybe get you 10 millimeters. But by the time we're done, you're only going to get 5 of the bone growing because the rest of it is the teeth tipping out.
Yeah.
So even with the most solid, durable, like strongest expander, you're not going to get 10 millimeters if you wanted it.
Yeah.
And so that's the limitation. So we're going to have to do another expander after this.
Hence phase 2.
Yeah. So even if you start early on your kids at 3.5, like you did for Tashin, right? You're still going to need more expansion because you can only get so far with one.
Right.
Now, say there's parents out there I know who want to try something less invasive that doesn't look as scary. A lot of people say that the type of expander I use might look, archaic or really aggressive. But again, you cannot move bone with something soft. So there's things out there, soft appliances that
I know there's the retainers, the tooth pillow, the off-brand tooth pillow.
Removables even. My expander, people make it removable.
Okay.
But if you remove it, the bone's going to collapse. You're going to lose whatever growth you've gotten.
Yeah.
Because it takes time for the bone to fill in. Because, when we're expanding Tashin, what we're doing is we're expanding. And once we do all the turns and they're done, we hold for 3 to 6 months. And that allows for the bone to fill in.
Right.
If you don't hold it, everything collapses back together.
Yeah.
So that
spend all this money and get a recurrence. You get like the
exactly
the accordion coming back together, and then what a waste.
Yeah. So anything soft, a soft appliance, which I'm not against them. They're great for myofunctional things. They're great for kids who are compensating a lot. Their musculature is not active the way it should be. So you can use these soft appliances and get your kid to close their mouth and chew on it and activate certain muscles and deprogram other muscles. But when it comes to actually expanding, it's not going to do it. And I've seen it on CT scans where I've had kids go to other dentists or other people who do expansion. They come to me and then we see tons of tipping of the teeth and the bone didn't actually grow in the center. And this is actually something that in the airway world, we've come to understand a lot better in the last few years.
Okay.
And it's because, not everyone was taking CT scans on kids. The other thing is the understanding of how to treat kids at such an early age. Not a lot of people were doing it.
Yeah.
And so the evidence is kind of limited. So you have a lot of orthodontists who don't feel comfortable doing it. So you can't just go to a traditional orthodontist and say, hey, can you start expanding my kid?
Yeah.
A lot of them are going to say, no.
Yeah.
You're crazy. We can do this when your kid's 8 or 9. The problem with doing it when they're 8 or 9 is, remember how I said the expander anchors to the teeth?
Yeah.
Well, the roots of those teeth are now short. And then the roots of the permanent teeth that it could attach to are also short.
Okay.
So when the expander's on that, you're mostly going to tip the teeth out because they're weak. They don't serve as good anchorage anymore. So the studies show it, the longer or the older a child gets, the less skeletal expansion you get, the more dental alveolar expansion you will get. So this is not even an argument amongst orthodontists. They know the literature. They know this is what it says.
Yeah.
So when I ask my ortho colleagues, why won't you start early? They say, well, I mean, these kids are difficult too. You got a kid with a sleep issue. They probably have a behavioral thing going on.
Yeah.
They're highly sensitive. They tend to be more sensory kids because they're not sleeping well.
Yeah.
And they're like, I don't want to treat a 3 or 4-year-old in my office. It just doesn't go with the flow of their practice.
Yeah.
And that's legitimate. Like,
thank God for you though, honestly. Like, I feel like Tashin's name's on the sign. There's like toys in the waiting room. He gets like a little car when he leaves. Like, it's like a whole it's a whole experience. And did it take us, because he taught, both of them are getting their tops and bottoms on Friday. So I'll see you again this week. But Tashin's bottom was put on like last week. And we were like, oh, it'll be easy. It's a second expander and like knock on wood, but like, or whatever. We like jinxed ourselves because he was like highly sensitive. And like, I don't think most dentists would have been as calm and patient as you, and like just rolled with it and taken breaks and let him play with your tools. And it was like a whole, I mean, there's a special type of person it takes to like help these kids who are underslept and waking up in the middle of the night multiple times and trying to just get away from adenoid face and get back to like, let's breathe and
get your face full.
Yeah.
Let's get it back to looking healthy.
Exactly. Like, I think it that's probably why they're not doing it.
Yeah.
It's a lot.
It is a lot. And so when an orthodontist will come to me and they'll say, well, how are you doing it? I'm like, well, I don't, have you been to a traditional orthodontic office? They tend to have a full open bay of chairs lined up, right? And then the kids are coming through pretty quickly, and that's how their schedule is set up.
Yeah.
And they schedule 30 minutes for these kids. These checks it's really fast.
Oh, yeah.
High volume.
Just a color rubber band change back in my day.
Yeah.
And then out the
You're
door.
in and out. It's really quick. And I don't do that. I schedule an hour.
Yeah.
These, your children are in their own room.
Yeah.
We don't have a bunch of chairs lined up, and that's intentional because, one anxious kid will make another anxious kid even more anxious, and they'll build off of that energy. So I did design my practice in a way to allow for that. And so, and plus as a pediatric dentist, we're just trained in working with kids and being patient with them.
Yeah.
So
such a different experience. I mean, like Tashin's like, I had to put a sticker on my calendar chart. It's turn number 4. And he's like trying to get more than 2 turns in a week. And I was like, no, buddy, she only said 2. I think we did like Tuesday, Saturday. And he was like, can we do Monday? And I'm like, okay, we can do Monday, Friday or something this week. But it's just like, it's a different experience. It's very fun. It's very, very kid driven. But knowing that like that growth and development is happening in those earlier years, and that I'm going to get more bone growth and less tipping. Yeah. I think, what you were talking about is like the most important part is actually the palate. Great. Let's get the tongue up there. But I think about like that nasal,
the nasal airway.
If you want like the nasal airway to be open, and then like where the air goes down, the esophagus, like everything to be open. Yeah. It's really that I don't want restricted for them mostly, so that they can be really efficient at nasal breathing and not just be like having tape injuries like me. I pulled my mouth tape off this morning and I ripped my lip off. I'm like, perfect, bloody lips for the podcast today. Here we go. But I'm noticing that I think, oh yeah, I'm a really efficient nasal breather. But to see such an improvement in my Oura ring after mouth taping, I'm like, maybe I'm sleeping with my mouth open and that's horrible. Yeah. So when someone is, speaking of which, when someone is a mouth breather or a child is a mouth breather, what kind of symptoms do you start to see? And we'll start with that.
Mouth breathing symptoms. It's a lot of things. I think from a holistic perspective, which is usually the approach I like to take, is when you come into my office for consultation, I'm not just, oh yeah, they're narrow, let's do expansion. It's, okay, what's their medical history? Do they have allergies?
Oh yeah, I know.
There's reasons why they cannot breathe through their nose, the enlarged adenoids, enlarged tonsils. And sometimes expansion doesn't help with that. They'll still stay enlarged. And then I have to talk to families about maybe going to see an ENT, which I know you didn't do that, which is totally fine.
We did see Yoshbi. So we did go down the rabbit hole of seeing her and our first CBCT with you. They were 70 or 80% obstructed with their adenoids and tonsils. And then we were like, oh my gosh. We went to Yoshbi. And then she looked at both of them and was like, yeah, we gotta like do this. And they were in the middle of that like first expander. And then Chris was like, well, you should see mine. And she's like, let me see yours. And then she was like, oh my gosh, you need to get yours out. And he was like, why'd we come here? And then,
so funny.
and then he was scheduled to get his taken out with her and chickened out like a week and a half before.
Aww.
And he's like, I want a second opinion. And I was like, that's fine.
Yeah, it
but
totally is.
We're going to Zoggy
Yeah.
if you want a second
Yeah,
opinion.
yeah, you
because
should. I think you
Zoggy's
should.
going to fix your deviated septum with a balloon.
Yeah.
And he's going to take your adenoids and your tonsils. So
and he's going to talk to you about all this other stuff.
Just tonsils to like full nasal hygiene.
And he's probably going to look at whether or not Chris is narrow and recommend doing some sort of surgery if he wants it to be long lasting.
It's crazy.
And it's hard. And that's the problem. And that's why we want to treat kids, right? Because if you want to get expansion, you and I want to get expansion at our age.
Yeah.
The jack screw has to be anchored into the palate. They're called TAD supported expanders. And that's a lot to go through as an adult. I've heard a lot of testimonies from adults who've done this sort of expansion, and they're like, actually, it wasn't too bad. It's better than doing facial surgery where they break it, they reopen that suture in the middle, they spread your palate open, and then they place plates to keep it apart so that bone can remodel on its own. But then you're not going to do surgery to remove those plates again.
Yeah. So
the alternative of temporarily anchoring the jack screw into the palate and you're turning a key, you should talk to Zoggy about it because he did it. And he has it on his Instagram. He actually did it. You get this gap between your teeth.
You're like full Lloyd Christmas with like just like a driveway through your face.
Yeah. But he's like, I can breathe so much better.
Yeah.
And he doesn't have a tongue tie. And so that's really important to know because not all people that have airway issues have a tongue tie issue.
Yeah.
But he will tell you, he's like, breathe so much better through my nose because there are studies that show that for every millimeter you expand that palate, that bone in the center, you actually increase your nasal volume by 1.5%. So say like Tasha needs 10 millimeters of expansion and never got it and then becomes an adult and needs that 10 millimeters of expansion. 10 millimeters of expansion is going to give you a 20%, 25% increase of nasal volume. You'll breathe that much better in your nose.
It's crazy.
So people don't consider that when we expand, we're not just treating this and making room for the teeth and making room for the tongue to sit up in there too.
Yeah.
We're actually opening up the nasal cavity that's getting wider. And so we're treating the whole nasomaxillary complex. And it's pretty crazy how much improvement people get. And it might keep them from needing full surgery where they have to break the upper or lower jaw and bring it forward. Maybe you just do an expander.
Yeah.
They call it MARPE or mini screw assisted rapid palatal expansion, but it's not rapid by any means, actually. You have it in your mouth for like a year.
Yeah. I actually did a consult with Dr. Yu in I think Calabasas or Aurora or whatever.
Yeah, Tim Yu.
Yeah. And he was, just because I know I'm doing this, clearly this is becoming an Airway podcast. My podcast producers are probably like, okay, enough with the holistic dentist and airway health. But I was like, well, if my kids all had this problem and I had to have teeth pulled and my tongue doesn't sit on in my palate, it like ruffles over the back teeth.
Yeah, it like spills over the teeth.
Yeah, it spills over the teeth. And I was even interviewing a doctor on my podcast and he was like, I think you have a tongue tie. This was like 18 months ago. No one had ever told me I had a tongue tie. I wasn't even down the rabbit hole with my kids yet. And I was like, what are you talking about? But I do have like tension and like just from my ears, from my neck all the way down. Like I'm always just so tight there. And this is kind of crazy. I know that fascia goes literally from my face to my toes.
Right.
And all that to say, like I need to get this is making myself sound old. I have to get a ceramic implant because I pulled out a bad root canal. And I know it's so sad.
Yeah.
Unfortunately, when I had that situation happen, the dentist was like, that was the best tooth I've ever removed. And I was like, word for the wise. That's not what you tell someone after they were undecided of being freaked out about a root canal or not and deciding to pull it out. And then you tell that patient that it was the best tooth. He was like, I thought it was going to be a show and it was great. And I was like, not what you tell me when my tooth is sitting on that tray. Anyways, I may have like jumped the gun on that. And yeah, probably could have lasted 5-10 more years. And eventually that would have been a situation. But anyways, down the rabbit hole, I was like, oh yeah, okay, I'll get this all ceramic implant. I don't want metal. And then Dr. Lydia, who's a friend of mine in LA, was like,
I love her. She's my friend too.
Yeah. She was like, well, if you're going to go down the rabbit hole of that and getting that all ceramic implant, if you ever wanted to do expansion, you'd have to do it now before you do that. Yes. And I was like,
she's right. She's totally right about that.
She's like, once you put an implant in your mouth, you don't want to have to, it's not mobile. You can't move it. So like, you got to do it now. And I was like, oh gosh, now I have to like go down adult expansion and tongue tie release and then get my,
and you don't want to do the tongue tie release potentially without expansion.
Exactly.
Because it can make your airway issue worse. Yeah.
It's just flopping around in there.
Well, the palate too small. You're not going to get it rested up in there. So it's going to be too hard.
And it's not even going to like move anything because it's soft tissue and it's nothing that's like anchored and yeah.
The tongue is strong, but it's going to tip your teeth out to try to make that space. And so any sort of cosmetic work you do in your teeth or braces to straighten them, the tongue's going to push on it and push it out.
Yeah.
And that's why we get relapse in orthodontics. You can do braces as a teenager, but you don't have the room. All the teeth are going to find its place where it needs to go because the bone isn't going to sustain that.
Right.
So that's why.
It's so crazy.
Yeah.
Like it's amazing to me that like one interaction with an OT led you to like going to this conference with Sagi, like, put you down the rabbit hole of being like an airway specific pediatric dentist, but getting these kids at that like proper time where you can help with facial development without like screws in the roof of their mouth.
Right.
You know?
Yeah. And you treat one jaw, you have to treat the other, which answers your question as to why we do upper and lower expansion, right?
Okay, go ahead.
So when you widen up the upper jaw, you don't want the teeth. They bite a certain way, right? Like your top teeth are supposed to bite on the outside, and then your lower jaw teeth bite on the inside. So if we're expanding the upper jaw and it's getting wider and you're doing nothing to the bottom, you have to either stop prematurely with the expansion, or you end up expanding where the teeth are way outside of the bottom teeth and your bite's going to be all
they have no anchor. How do you even chew?
Yeah, they're not going to contact and come together. So I want to be really clear about this too, because a lot of people talk about lower expansion and you really can't expand the lower jaw. It's impossible. There's no suture. If you look here, no suture, right? So you can't expand the lower jaw. The only thing you can do is take those teeth that are dumped in, because that's the only way they're going to bite with the upper jaw, and you tip them up. And when you do that, it allows you to expand even further. So if we're trying to achieve the full 5 millimeters of expansion, we really need to expand as far as we can.
Yeah.
Because there is going to be some relapse from the teeth tipping back in. So I do like to upright those lower teeth on the bottom at the same time so we can get the most out of it.
And that they hold. And they have a place to anchor and contact.
Yeah.
Okay.
So the teeth can bite together.
So then when, let's say, I mean, just thinking about like the CBCT you did on Sebastian, what are some of those measurements that you're getting? Obviously, you're getting the width between the back teeth, and then you also do the palate, but you were measuring like ear to nose to eye. Like, you're like a whiz on your computer with like the arrows. And I'm like, we don't know, but she'll explain it in 2 minutes when she's done taking her measurements.
So it's a lot. So one of the things I like to look at is we'll take a slice of the scan and we'll look at the face down the center and we'll take a profile view of it. And there's something called a cephalometric x-ray that a lot of orthodontists take, and we do tracings. And the cranium, the base of the cranium is stationary. That's where your spinal cord comes down, and the cranium is stacked on top of that. And so we like to take measurements to reference where the upper jaw is in relationship to the cranial base and the lower jaw is in relationship to the cranial base. And we look at certain angles and measurements to see if we have enough growth this way, what we call anterior posterior development, AP growth.
Okay.
And so that's this is a 4-dimensional thing here.
Yeah.
And when we're expanding, we're only addressing this dimension. Yeah. But there's still this growth forward.
So not just wide, but forward. Okay.
And that might be lacking. So since the growth of the lower jaw follows the upper jaw, If the upper jaw is not growing, the lower jaw can't come forward.
Yeah.
And so that's another thing I'll see is even in photos, you can see it. Somebody with a retruded jaw, like recessed, you'll see it.
Yeah.
The lower lip will tuck underneath the upper lip. And if we want to bring that forward, it's done growing by the time you're like 12 years old. So it's hard to bring that jaw forward at that age. You can't. And so even in an adult with a retruded mandible,
breaking jaws.
You can't breathe. And then you have to break the jaw to bring it forward, place a plate. And I did a residency after dental school as a general practice residency with a bunch of oral surgeons. There was no oral surgery residency in there. So I went into the surgeries with the oral surgeons.
Heck yeah.
We wired people shut. We did mandibular reduction surgeries. We placed orbital floor meshes. People who had traumatic car accident injuries, panfacial fractures. So I did zygoma repairs. This is very unusual for a pediatric dentist to have this sort of
training,
background and training. But I got it, which helped me to understand facial bone structure so much more, especially when it came to that's what they do when they're fixing these is sometimes the bone is so smashed that they have to print a prosthetic to place in there, like a metal prosthesis to rebuild the zygoma.
Wow.
And so when we look at how to do that, and if we could have just, and this is how they do the surgeries for sleep, for making the airway bigger, let's just do it in the kids, but do it non-invasively.
Yeah.
And so this expansion and development, making the upper jaw wider, getting the lower jaw to come forward, it makes a big difference for these kids, especially when the lower jaw grows forward the most. And I'll go back to why I treat infants, is because the lower jaw grows the most forward in the first year of life.
Wow.
So we did Julian's tongue tie release.
Yeah.
And he was how old again? Remind me.
So we just did it before we left, or when we got back from our trip. So he was 2.
He was 2.
Yeah.
And so he probably has a little bit of retrognathia. The good thing is most of the lower jaw grows in the first 3 years of life.
Okay.
Most of it's in the first year, though. It grows forward about 15 to 18 millimeters in the first year of life. The second year, that cuts in half.
Mm-hmm.
The lower jaw grows forward 8 millimeters.
Okay.
Then the third year of life, it grows forward 4 to 5 millimeters. And then after that, it's just 1 to 2 millimeters each year.
Yeah.
So if we want to get the lower jaw to grow in a better place, we really want to encourage good function from infancy forward.
Yeah.
So treating the tongue tie right at birth, getting them to function well, and then making space after that so that as they continue to grow, we can get that jaw in a better place with myofunctional therapy, of course. But
well, it's kind of interesting because I really wish I didn't have a lactation consultant for Toshin or for Julian, and both of them have pretty severe tongue ties.
Yeah.
Well, Julian doesn't anymore, thanks to you.
Yeah.
But I just, I learned to breastfeed Sebastian after he came home from CHLA. And, he is bottle fed at first, TPN nutrition first, then bottle fed.
Yeah.
Then we finally got him on the breast. And I was just happy that he was a breastfeeding baby. And then with Toshin and Julian, it felt easy. But when I look back, I'm well, Toshin was kind of pinchy and Julian was kind of pinchy and squeaky. It would be a little bit of a funny, sometimes a funny slurpy sound. And when I think about it got, both of theirs are pretty bad. Julian's not anymore. But when I think about it, even when he was around, 4 to 6 months when we were introducing solid foods, I was wow, this kid, he choking more, he couldn't get his food with his tongue to his teeth. It was just flopping around in there. Yeah. And then we came to see you and it was he had 2 buccal ties, a lip tie, and a tongue tie. So can you talk about that restriction? I understand a tongue tie restriction and how that would keep you from getting that palate expansion, because obviously if it's not giving the pressure on the top of the roof of the mouth, you're not going to have that growth and expansion. But what about all those other ties? And I mean, I really wish I would have just seen a lactation consultant with both of those, because I think I could have gotten Julian's figured out at such an early age. And because it's hard to do myo with like a kid who's...
Right. And you can't. There's no such thing.
So you're not really doing myo till they're 4 or 3.5 or 4 when they can actually do some of the exercise.
They can follow directions and they can respond.
Yeah, it's like eating therapy right now, which is good. Like we're getting some movement, but it would have been so much easier had I known it.
Right.
Tongue tight, released, and like allowed him to nurse and get that mewing right.
Yeah.
You know?
Yeah. And that's just giving the tongue full range of motion. And that's, when your tongue is tied, it can't elevate. So it's the elevation that's most impacted. And the rest of the, I'm going to take it. Let me.
Yeah.
Get your tongue model.
Yeah. Get your tongue model.
So here's the deal. You're trying to get, when you're breastfeeding, your baby has to pop on, latch onto the breast, lift the tongue, and they're curling and cupping it too. So these are skills, and then they start sucking.
Okay.
Now, the suck is a reflex when they're first born. That reflex develops in utero.
Yeah.
And then they're born with that reflex, so it happens automatically. That's why babies root. You like touch them here and they're like, you're just like, going for it.
Yeah.
And they start sucking. You put something in their mouth, they start sucking. So that reflex is there to help them. So when we release the tongue tie, it allows the tongue to lift up and suck without compensating.
Yeah.
But before all of that, you have to latch on and get a seal.
Yeah.
And the lips are what helps to create the seal. And the cheeks, when the lip is tight here, it pulls on it. You can't flange the lips. And so flanging of the lips is really important, because think of what you do when you're drinking from a straw.
Yeah.
You're not curling your lips under to drink, because you're going to leak all over the place. It takes way more effort to get a seal.
Yeah.
And so when you're actually flanging and bringing your lips together, you can get an effortless seal. And then once you get the seal, you can get negative pressure in your mouth and you can pull the liquid up.
Yeah.
So when the lip is tied, you can't flange. It tends to curl under.
Yeah.
And so moms will say it like, it kept having to flip.
Pinching.
Yeah. And so, if
you
can't
physically move their lip open.
Yeah.
Yeah.
Yeah. And if you can't seal with your lips, what are you going to use?
A bite.
You might bite.
Yeah.
And so that's a compensation that babies will use, is they'll bite. And then the other thing is the cheeks. When this is tight, when you're flanging, it's not just the lip here. It's also here on the side. Like being able to get this part of your lip up too.
Yeah.
But if this is tight, I actually have a really great video I just took on a baby where we released one cheek and you could see it flange so much more before we did the other. And I would bring this together and you would see the lip was stuck on the side that wasn't released yet. Like it just wasn't flanging. It wasn't coming up.
Yeah.
Then we released it and the whole thing was way better. And I've done only, early on in my career, I would only do lip first to see what would improve. And then I would do lip and cheeks to see what would improve. And usually across the board, what every mom would say improved was, the initial latch when they first get on isn't as pinchy anymore. So that's that pinchy feeling in the initial latch. And then they get into a groove and then it's fine. Most moms can tolerate that. They're like, it's a little pinchy at first, but whatever. They figure it out.
Yeah.
But
I just worked through the pain. I was like, it's fine.
And I did too, actually, because my daughter was like that. And I'm like any other mom. I didn't want to release her lip and cheek ties. Like, I know they're tight, but I'm going to wait.
Yeah.
My son, I did his release for lip and tongue when he was 3 days old. I did it really quickly.
Yeah.
I'm like, I'm just going to wait with my daughter.
Yeah.
But when I waited, I'm like, okay, I can feel the pinchiness. Like I get that. And I knew what it was and I still didn't want to do it because nobody wants to do a procedure on their baby.
Yeah. Yeah.
I get that.
Yeah.
So I didn't do her tongue right away. She had a better latch. Things did improve from getting the lip and cheek tie released. But what I found without releasing the tongue tie is she was really inefficient. And that's the symptom that I see across the board with every baby that's tongue-tied is they are going to be really inefficient with their feed. And so what does that look like?
They're frustrated.
They're going to take too long.
Yeah.
Because if you're not efficient, it's going to take you a lot longer.
Yeah.
Or they're not getting enough in one feed. So they'll cluster feed.
Yeah.
They'll suck. They won't get enough. It's so much work and effort. They fall asleep. And then 20 minutes later, they're like, I'm still hungry. I didn't get enough that first time. And then they keep cluster feeding. So when we do a tongue tie release, and for my daughter, she was waking up every hour of the night. And that's when I finally said,
Mom's sleep deprived. What's going on?
I'm going to do her tongue tie release now. And I did it I went all weekend with that. Monday, I went in, and my other doctor who works for me, Dr. Trisha.
Yeah.
I had her do it.
Yeah.
And I'm like, oh, thank God. She went from feeding 4 minutes at a time to 12 minutes.
Wow.
Like that's how much more efficient and effective she became immediately after the tongue tie release.
Wow.
And I'll have moms like you who will say like, oh, they were really good. But then when I dive deep into it, did they take a long time to feed? Did they get enough? Did they seem like they were feeding all day? Yeah. And that's normally they were kind of always wanting to latch on. I always thought they just wanted comfort, but maybe they didn't get enough if I think back. Yeah. I'm really honest with myself.
Yeah, I actually feel pretty lucky looking back because I feel like a lot of moms whose children are cluster feeding, they're getting frustrated, they're not getting enough food, they end up supplementing with formula because they're like, maybe I'm not producing enough, and they start to like self-blame or thinking it's like on them, or they spend like hours pumping and then trying to bottle feed. And I feel like I feel lucky that I like didn't end up doing any of that. Like Tashin was a COVID baby, so I could like Zoom and feed and just be on mute.
Yeah.
And then, and I had a little more flexibility by the time Julian came around, and I could take some time with him to like nurse and like feel like, okay, we're good. But I could see how that could easily happen, and you just kind of blame it on yourself for like your,
it's just how they are.
Yeah, exactly.
Okay. Because if you have other kids, you're so busy. Do you really want to stop and address all of this when you've got 2 other kids to take care of, and you're an entrepreneur. You got a job. I've got my practice. I didn't want to. I'm like, I just need to get back to work. I don't want to keep patients waiting. Everybody's like that. We make decisions based on those things, but I try to be as objective as possible. Because even for me, I'm like, she's feeding great because my supply was so good too. Yeah. Like my letdown was great. She was like gaining weight fine. That wasn't the issue for her at all. Yeah. So I'm like, oh, okay, waking up every night, every hour of the night, that's when I had enough.
Yeah, you're like, actually now it's impacting all of us. Yeah. Mom is not right. We're clipping that tongue. Yeah. But her palate will be a benefit from all of that. And like her future airway health. Yeah. She won't be like me where she's doing a consult on an adult expansion at, 42 years old.
I need all of that too. You're not the only one.
I mean, it's interesting. It's just, I think I'd much rather like get my airway health right and feel energized and feel like I'm getting a solid amount of oxygen and nasal breathing and all of that properly. And if there's any like tension here, like I've read some testimonials where I'm like, wow, that would be great just to like kind of feel like my shoulders drop down an inch or two, instead of being pulled up into my ears. But Airways become so popular. And I think, I don't know, I would be curious what you think the future holds. But I think about a couple expansions and like literally not needing braces and getting all your teeth to
sounds great,
fall
right?
in, I mean, it is pretty funny because Sebastian's in first grade now. And there are some kids in first grade that are losing their first tooth. Yeah. And Sebastian has like chiclets. Yeah. And his like
everything's super close.
His adult huge like front 2 teeth in the front have like dropped in, and he's lost 8 teeth already. And his like, you've seen his CBCT, his adult teeth are quite large, Yeah. And I would love more than anything to make space for all of it. But you did say like you take a really big health history. And one of the things you noticed with Sebastian was some like asymmetry. Yeah. So can you talk a little bit about some of the things that you would want people to look out for when they're considering expansion on their kids? That would be like, not red flags, but hey, this is important to know prior to doing this, or you need to, because you kind of have given me like other doctors to see too.
Probably sent you to an osteopathic doctor, cranial chiropractor.
Yeah, craniosacral. We do need to get Tashin in with the naturopath to like really kind of like deep dive his allergies outside of like just the traditional allergist.
Yeah. I think we saw some signs of maybe some chemical breakdowns, maybe some acid reflux. Yeah. Yeah. And we can see those signs on the teeth. When I see asymmetry in the face, it could be, here's a simple thing. They could just always be sleeping on one side.
He had torticollis.
And they're growing.
And a helmet.
Is another thing. Yeah. So, and that's early on, and it could have been the tongue tie fascial tissue that was pulling, and cause them to continue being that way. Because I'll release a tongue tie in a baby and the torticollis will improve dramatically for them.
What?
They still need to get body work done to
Yeah.
make sure all of the fascial tissue in the body gets unwound. But
Yeah.
I've seen it in babies. They just, all of a sudden, they couldn't turn that way and we released a tongue tie and they're just loosey-goosey everywhere. And mom's like, wow, you can palpate that the tension in the body isn't there anymore. Like they can hold their baby and they're not tightening up.
Yeah.
So it's probably, that's something to consider. Sometimes it's how they're sleeping. And, but imagine if fascial tissue covers everything in your body, including your cranial bones. And if you've got torticollis and you're always turning this way and you're off and that fascial tissue's pulling, well, it's going to pull here on the cranium too. And if you're trying to release that, even if you do a tongue tie release or we expand, it's still going to be pulling. So if you expand, you could expand asymmetrically because here you are trying to get this palate wider, but the fascial tissue is still pulling. And that's why I would want for you to still take Sebastian to get body work done while we're expanding, because then an osteopathic doctor, cranial sacral therapist, cranial chiropractor, they can release that fascial tissue, adjust the bones so they're in a better position so that while we're expanding, things can expand in a better trajectory, more symmetrically. So that's
it's crazy to me because I think about when I was younger, my parents were like, yeah, you went to the dentist a couple times a year and they put like the pink tablets in your mouth. And then, you get to be a teenager and they just throw your braces on one time. And now these kids have braces for like 10 years. And like, now we're moving back. But I mean, I think Airway, I'd much rather like focus on airway health and get people breathing better and like
100%.
facial optimization for athletic performance, brain health, cognition, all of those things, then just kind of make it look pretty from the outside.
Right. And also when you're like, when you look at this, the data, sleep issues, it's an epidemic. It's a big problem. All these adults have a sleep problem. So I'll get adults who will say, well, I'm okay. Even orthodontists will tell me, well, I don't have these issues. I'm like, looking at you, you probably do have these issues. But I would say the ones who are diagnosed with sleep apnea and deal with these issues are going to be the doctors and providers that are going to look more into this. And when you understand how the development happens so early on, and you understand what needs to be done for an adult to fix this problem, that's when more and more doctors are going to be like, no, we definitely need to start treating this early. And you'll have less and less doctors looking at this as over treatment, because some people are going to look at it that way. Like, you're treating your kid at 4 years old. And they're going to be in treatment for this many years. They're going to get burned out. But the alternative is you do nothing or you only do a little bit and they still need it when they're older. And then when they're older, you're limited with how much you can get and you need surgery.
I'd much rather my parents have focused on like airway health. It wasn't a thing back then, but that would have saved me right now,
Let's
so
breathing through your nose. I'd love to breathe through my nose more effectively. And so
geez. I mean, it's just an intertwined web, but all with the goal of like better airway health, less like calcified tonsils and adenoids, like, just better quality of life, better learning, better sleep, better mood. I mean, I've noticed pretty significant changes in my kids, and we're halfway there, I would say, or maybe 2/3 of the way towards that.
I will say I learned a lot
development
with you getting expansion when I was on maternity leave. It was for Tashin, right? And he had enlarged adenoids, right? And then you did expansion, but he had some symptom improvement from the expansion, right?
So he went from like 70% obstruction to 30% obstruction. And, it's kind of hard too, though, because it depends on like the time of year. Were they in school when we did it? Like, was he dealing with like a virus or an illness or whatever? But he did have some major improvement with that. I was surprised at how much healing happened for him.
Lots of families where we decided, because a lot of parents don't want to take their kid to a hospital to get surgery to have their tonsils and adenoids removed. And I know the studies show that for 8-year-olds and up, when we expand, we actually create more space. And so the tonsils and adenoids don't necessarily shrink, but they have more room to live in your body. So when we expand, we create more space.
It's okay. There's more space.
But all of that is to say is sometimes rather than going the surgical route by removing them, expanding can actually help.
Yeah.
And there's not a lot of studies in the younger population, like for Sebastian's age, but hey, it's totally worth doing.
Yeah. And we got to a place where they're at a place where certain ENTs would say like, no, they're not bad. We're not taking them out. And maybe certain ENTs would say like, okay, maybe given their history, because that's the thing with Sebastian is like, we've had so many allergies for so long. We've been mouth breathing and like mid-tongue restricted for so long. Mm-hmm. And we're like doing the myo and we're seeing some improvements, but it's still like on the CBCT you just took a couple weeks ago, like you showed me the air bubble in the back of his tongue where it wasn't like fully suctioned to the roof of his mouth, and I don't want to like do surgery and pull out organs that I don't know much about. You know, people are like, oh, it's no big deal. These organs, they just live there and like we don't need them anymore. Part of me is like, is it going to come out that we do need them? And I'm like taking organs, adenoids and tonsils out. But like my brother-in-law had that surgery and he's fine, but he used to have like recurrent strep throat and crazy infections. And I think about that, like for Sebastian, that he kind of does, he's my sick kid. Like he's
sick easily. He has a hard time recovering.
Yeah. And he's constantly like the kid blowing his nose in class. And like, he just, both of the CBCTs, you're like, his right nostril or his nasal cavity is congested right here. And it's like, he's not showing symptoms of being sick yet. And then, 10 days later, a week later, 5 days later, he's got like a sinus infection or a cold. And he's, we're using the neti and we're doing the nasal hygiene. We have the xylitol nose spray. Like at a certain point you go like, this kid's up against a rock in a hard place. Like, even though we've expanded and we've seen some healing, like would it be a benefit to him to like remove those? And I even like brought it up to Chris yesterday because I was like, I'm having Dr. Tran on the podcast tomorrow. We gotta call Dr. Zaghi and get your stuff out of your mouth. And he was like, no. I'm like, yes.
Well, just to give you some comfort around that though, the tonsils and adenoids help. It's a lymphatic organ, right?
Yeah.
It helps to detox bacteria, debris, like air that you're breathing that's not clean. And it pulls all of that stuff inside of it. And there's lymphatic nodules inside that help to clear it.
Yeah.
And so what happens over time is if it's too overburdened or you have something inflammatory going on, it gets inflamed. Now, inflammation acutely at that given moment, like you get sick, they get enlarged. Okay, no big deal because they're inflamed. We know that once the sickness goes away or you remove the whatever foreign is causing it to be inflamed, like whatever you're allergic to or reflux, you solve that issue. Mm-hmm. Then if the inflammation goes down, the size will reduce because that's what inflammation is. Things get swollen. That's one thing. But if you've had chronic inflammation over time for an extended period of time, then what happens physiologically is within the tonsil and adenoid tissue itself, it starts to scar.
Yeah.
And when it scars, the lymphatic nodules can't do its job. Anything circulating in isn't going to come out. Mm-hmm. And so that lymphatic tissue stays enlarged. Mm-hmm. And so what we'll look at and what I'll see is I'll look in a kid's mouth and I'll say, the tonsils are big, but they're really red. Let's try something to reduce the inflammation. Mm-hmm. Or I'll get the kid where it's really big, but it's pink and healthy. Mm-hmm. Nothing's going to reduce the size and it's taking up room to breathe. Mm-hmm. Then there's a reason to take it out. Yeah. And that you might come to that realization or that.
I feel like I'm like, no surgery. Why would I do that? And then I'm like, okay, we're healthy. Yeah. And then we're still getting sick. And I'm like, dang it. Like I kind of, So I brought it up to Chris. I was like, we're going to take yours out. And I'm like sort of still thinking about Sebastian. And he was like, why? I feel like I'm on this roller coaster with you. Yeah. I'm like, I'm the only one thinking about this. I'm just bringing it to the court, babe. Like we gotta talk this stuff out. You know, I don't want to be like the one person deciding whether we're taking our kid to surgery or not. But I also he just is all gas and no brakes. The kid wants to play every sport. He wants to go to school. He wants play dates on top of it. He wants Chris to take him surfing. Like he has all this like zest for life and energy. And then I see him hit these walls and I'm like, if he's not sleeping well and he's trying to be all gas and no brakes and he's constantly getting sick, like I need to help his immune system. And I'm obviously like doing the supplements and doing all these like extra things, but it may just come to that. I just haven't decided yet.
Yeah. And you'll know when you get there.
We'll expand him again. And
I was going to say, we'd always expand him again and see how he does, because sometimes when we expand and the nasal cavity gets bigger, then everything in the sinuses can drain out a little bit more easily.
Yeah.
So then maybe he won't stay sick for as long. Maybe those things will get better for him. So I'm not totally against it ever. I just always want families to know, okay, this is the bigger picture and maybe we might need to address this, but we can always do this first. There's no right or wrong way to approach it.
Totally.
So
it feels very just holistic and inclusive of other physicians and like support to figure it out, which I really appreciate.
Yeah, I know it's overwhelming.
No, all my eggs,
family out there.
But you've taken so much time with our family to explain each of our children and like their measurements and what's going on and what they need. And they're we just want to support them to be the best version of themselves. And I know that like really good sleep, really good hydration, really good air quality, you know, and oxygen to their brain and all the nutrition and all the activity, like all of it kind of adds up. And you're a big piece of that puzzle. So thank you for all of your help.
You're so welcome.
And for taking the time to explain it all to our family. I like couldn't be more grateful.
Yeah.
Yeah.
It's like the most rewarding thing for me.
Yeah. No, I mean, it changes lives.
It
really truly like their genetic potential changes. Yeah. And it's a big deal.
They do so much better. When I see these kids thrive, it like is very validating for me to keep doing what I'm doing. So
yeah. And you have all the patience in the world for it. So I thank you for that too.
The kids need it. They need it. So.
They do. They do. Well, Dr. Tran, where can people follow along? Where can they learn more? Where can they get in touch with your practice?
Yeah. So just the way I treated your family, I treat every family that same way. Nobody's going to get any more or less. I'm in Newport Beach. I'm actually going to be moving my practice. Building I'm in got sold.
Okay.
So I have to be out by March 1st.
Oh my gosh.
I'm looking for a new space, maybe in Newport, maybe somewhere in central area of OC.
Yeah.
I was thinking about Tustin, Orange. I don't know.
Yeah.
That's out there. I'm going to let the universe help me figure it out.
Yeah.
But you can follow me on Instagram. It's at Dr. Tracy Tran. I'm putting together more content to put out there for educational purposes. I just want families to be able to make a good decision about, entering this whole airway space. And then, they can call my office, email, text, all of it. A lot of moms love to text. So we always text and it's easy to get a hold of us through text message. And then, I'm there as support. I've got other doctors working for me, and I'm hoping that with the new space, we can make it more of an airway center. So have a myofunctional therapist there, have somebody treating adults who want to get tongue tie releases. Maybe if I get lucky, I can find an ENT or a naturopathic doctor, just other non-anatomic things that cause sleep issues. Because I address the anatomical things, like making the mouth bigger, creating space. But sometimes there's vitamin D deficiency. Sometimes there's iron deficiency. We won't go down that whole thing, but just know that I'm always looking at all of the different things that could be contributing to the overall bigger problem. So.
Well, it's not the way that you were trained, and it's really, really wonderful to see that you're just looking at the whole human. And I've appreciated every single one of our recommendations from you outside of your practice. And it just helps us as parents really take care of our kids from a holistic place. So thank you for all that you do and for being a guest here and explaining it all.
Having me.
And now everyone listening, check your kids' tongues. Go see an airway dentist. And if you live in Southern Orange County, Dr. Tracy Tran.
Yeah. Thank you.
Yeah,
you're the best. I love you.
I love you too.
Thank you for tuning in to this episode of the Be Well by Kelly LeVeque podcast. If you enjoyed the show, please consider leaving a review in your favorite podcast app and subscribing on Apple Podcasts, Spotify, or YouTube. We're also excited to share that full-length video episodes are now on YouTube and Spotify, so you can watch along as you listen. The best way to support me and the show is by sharing it with your friends and family. Your recommendations make all the difference. This is a Wellness Loud production produced by Drake Peterson. The video is recorded by Luke Rodriguez and edited by Jesse Trout. Sound mixing is by Mike Fry. See you next time.
The content of this show is for educational and informational purposes only. It is not a substitute for individual medical or mental health advice and does not constitute a provider-patient relationship. As always, talk to your doctor or healthcare team first. Shout out to the Newport Beach Pendry for hosting us. I'm so grateful to record in such a beautiful space that truly elevates the podcast experience for myself and my guests. From the stunning design to their incredible hospitality, it's the perfect setting for meaningful conversations and creative energy. Hey, thanks, Pendry.